Disability service providers are calling for transparency and collaboration from the Minnesota Department of Human Services. This as DHS announces another crackdown on those support services for lower-income Minnesotans.
In its move to combat fraud, the agency is now pausing new licenses to home care providers. Renee Cooper joins us now with the impact that decision has, Renee, on people who rely on those services.
Yeah, there's a lot to parse out here. Unlike the other related program pauses, in this case, people are not losing their current home and community-based services. But starting January 1, DHS will stop accepting new applications from providers, and a couple thousand pending applications will be thrown out, which leaves people in need waiting on that care out of luck. Can you talk about how long some of these people have been waiting, who they are, and what this effectively means for them now?
Yeah, I mean, the individuals at the end of this that were depending on and counting on those services to be there for them or their family members that are just essentially disappearing.
Josh Berg is a director for disability service provider ASI and vocal advocate. I first interviewed him in June when DHS was dealing with a backlog of hundreds of license applications. At the time, his client, Justina Bladaman, had waited more than a year for DHS to approve round-the-clock care provided by ASI in an apartment in her community.
It's so simple, but they're making it harder.
Now, that application filed by Berg's company will be canceled, along with more than 2,300 others.
The moratorium isn't unreasonable. I mean, and if it wasn't an effort to pause things, to allow the department to catch up, that's one thing. But then to go back and retroactively cancel for the people that have been counting on those services, it's taken to a whole different level. And I think that's where so much of the frustration and concern is coming.
In its notice to legislative leaders, DHS said the number of home and community-based service licenses has outpaced the number of enrolled participants, with new applications growing by 283% in the last 5 years. Can the need really be that great, or is DHS onto something here with using this strategy to combat potential fraud in the program?
Yeah. No, I mean, and I think it's a fair and great question. I think the challenge is not one license, one provider is not equivalent to another one. And I think that would be a question that I would have for the department is, you know, of those new licenses that are being applied for, what are they trying to apply? Is the need for that specific service that they're going after, is that there? I mean, it's not as black and white as I think they want to try to make it out to be.
Now, as Berg was getting out there, applications can be from new providers or existing providers hoping to add services. Some have a few clients, while others are much larger, and some clients rely on multiple services. So I asked DHS for a breakdown of those pending applications because we have not heard back. And DHS has also said they're going to grant some exceptions in this moratorium, but we still have no details on that either.
A lot of people waiting for those answers. Renee, thank you.
Yeah, you bet.